What is lymphedema? Lymphedema is a complication that can develop when lymph nodes are removed or damaged. Removal of lymph nodes at the time of surgery or radiation treatments to an area with lymph nodes may increase your risk of lymphedema. This video will help you understand lymphedema that occurs in the arm and how to effectively recognize signs and symptoms should they develop. You will also receive a booklet called the Lymphedema Program for the Arm. This booklet contains information and resources to help you understand lymphedema and how it is treated. Please review it and share it with your caregiver or family members so that they can help you during your recovery. Lymph nodes can be found throughout the body and are usually concentrated near and within the trunk of the body. The main purpose of the lymphatic system is to carry lymphatic fluid throughout the body and filter waste the body does not need. One or more lymph nodes may be removed for a biopsy, or all may be removed as determined by the surgeon. A simple way to think about lymphedema is to imagine a highway lane being closed. When the lane is closed, all the traffic or lymph fluid must travel through the other lanes. This can cause congestion or a backup of lymphatic fluid within the lymph vessels and can result in a swelling in the arms called lymphedema. Lymphedema of the arm can happen at any time, but most commonly occurs within 1 year after your surgery or treatments. The signs and symptoms of lymphedema can include heaviness and achiness in the arms, swelling and unusual hardness in the arms or hands, redness with swelling of the skin in the arms, and flaky skin, also known as cellulitis. If you experience any of these symptoms, please contact your doctor. You may be referred to a certified lymphedema therapist who can help manage your lymphedema. It is important to begin managing your lymphedema as soon as it is detected to help it minimize any discomfort or swelling. If treated early, lymphedema can be reversible. Treatments of lymphedema include skincare, manual lymph drainage, multi-layer compression bandaging, and therapeutic exercises. Guidelines to help prevent the onset or worsening of lymphedema. Your doctor has provided the following guidelines for your arm on the surgical side. The goal is to keep your affected arm protected to prevent the onset of worsening of lymphedema. Take care of your skin by cleaning it daily. Apply unscented lotion to your arm to help avoid drying or cracking of your skin. Be mindful to protecting your affected extremities to avoid scratches, cuts, bites, and burns. This includes wearing sunscreen or insect repellent when outside. Avoid wearing tight clothing or jewelry on your affected arm. We recommend beginning or resuming an exercise program. Start slow and gradually work toward more strenuous activities. Maintain a healthy weight. Isolated reports of lymphedema have been made after needle sticks and air travel, but have not been supported by scientific studies. We recommended the following exercises to increase movement of your affected arm and improve lymphatic fluid drainage. This exercise program may help in your recovery. The following exercises can be performed after surgery while drains are still in place, unless otherwise instructed by your surgeon, nurse, or therapist. All exercises should be performed 2 times per day as tolerated. It is important to remember, never push yourself into a painful state. Deep breathing. Standing, sitting, or lying down, place both hands on your stomach. Take a deep breath in through your nose, expanding the stomach. Then exhale through your mouth while tightening the stomach. Perform 5 times. Chin curl. Standing or sitting, curl your chin to your chest and hold for 5 seconds. Repeat 10 times. Neck rotation. Standing or sitting, turn your head to look over to your right shoulder and hold for 5 seconds. Then turn your head to look over to the left shoulder and hold for 5 seconds. Repeat 5 times. Neck side bend. In sitting or standing, tilt your head to the right shoulder and hold for 5 seconds. Then tilt your head to the left shoulder and hold for 5 seconds. Repeat 5 times. Shoulder shrug. Standing or sitting, bring both shoulders to the ears and hold for 5 seconds. Repeat 5 times. Shoulder circles. Standing or sitting, roll shoulders backwards and repeat 10 times. Then roll shoulders forward and repeat 10 times. Shoulder pinch. Standing or sitting, pinch shoulder blades together by bringing both shoulders back and holding for 5 seconds. Repeat 5 times. The following exercises should only be performed after drains have been removed, unless otherwise instructed by your surgeon, nurse, or therapist. Never push yourself into a painful state. Forward raise. Lie on your back. Clasp your hands together. Slowly lift over your head until your hands are pointing to the ceiling. As you are more comfortable, lift your hands over your head. Hold the stretch for 10 to 30 seconds. If tolerated well, hold the stretch for up to 1 to 2 minutes. Gently lower your arms back to the starting position. Repeat 5 to 10 times. Side raise. Lie on your back, slowly slide affected arm out of the side and upward towards your ear, keeping the arm straight. Do not raise your arm off the bed or the floor. Hold the stretch for 10 to 30 seconds. If tolerated well, hold the stretch for up to 1 to 2 minutes. Gently slide arm back to the starting point. Repeat 5 to 10 times. Butterfly stretch. Sit or stand tall with your hands behind your head, elbows facing forward. Move elbows backward until you feel the stretch in your chest. Hold the stretch for 10 to 30 seconds. If tolerated well, hold the stretch for 1 to 2 minutes. Then bring your arms forward, trying to touch the elbows with the hands still behind your head. Repeat 5 to 10 times. Wall climbing forward. Perform exercise standing. Face a wall with feet at shoulder width apart. Gradually walk fingers from waist level upwards until you feel a slight stretch. Hold the stretch for 10 to 30 seconds. Then walk fingers downwards back to the waist level. Repeat 5 to 10 times. Wall climbing sideways. Perform this exercise in standing. Turn sideways until standing beside a wall. Gradually walk fingers from waist level upwards until you feel a slight stretch. Hold the stretch for 10 to 30 seconds. Then walk fingers downwards back to the waist level. Repeat 5 to 10 times. As your tolerance for your stretches improve, try to hold the stretch longer and you can do fewer repetitions. Please refer back to the packet for a written guide along with this video and contact your physician care team with any questions.